Welcome back to the Happy Horse Nutrition Podcast. I'm Dr Nerida, and today we're diving deep into something that affects all of our horses, back health. I'm absolutely thrilled to have Dr Nicolle Wiechula joining us today. Nicolle is a specialist in equine sports medicine and rehabilitation with a particular interest in muscular conditioning and multidisciplinary rehabilitation, and has an impressive list of credentials, including her veterinary degree, master's degree, and is a registered specialist with the American College of Veterinary Sports Medicine and Rehabilitation. Nicolle is also an official FEI veterinarian for show jumping and eventing. All this to say she really knows her stuff when it comes to keeping performance horses sound. I love Nicolle's passion for client education and her desire to have all of us remember that owning horses is meant to be fun. And I know you are going to feel that come across as you listen to this podcast. Today, we're going to bust some myths about back pain, talk about the difference between primary and secondary back issues, and most importantly, give you practical tools to keep your horse's back healthy and strong. Trust me, this conversation changed how I think about back health, and I think it is going to change how you think about your horse's back health too. So let's dive in with Dr. Nicolle. Hello and welcome to the Happy Horse Nutrition Podcast. I'm Dr. Nerida, and today we have with us Dr. Nicolle Wiechula. Nicolle is a specialist in back health, and today we are going to be talking about back health basics. So big welcome to you, Nicolle.
Hi, Nerida. Thank you so much for having me. I'm really excited to be joining you on the podcast and being on this side of the microphone. It's going to be a lot of fun.
Oh, so much fun. Nicolle and I have done some nutrition podcasts on your podcast.
The Ultimate Equine Podcast. We're bright yellow. You can't miss us.
Yeah, it is bright yellow and it does stand out when you search for it. So I will put the link to that in the show notes for this podcast. So anyone who's interested in more detail on things that we talk about today, you can go and grab it there. So Nicolle, can you just give us like a little 2-minute snippet on how you ended up in this space? So you're a veterinarian, but how did you end up so passionate, I guess, about back health in horses?
Yeah, so I was actually really lucky where I started doing my master's degree, which was part of my residency program to become a specialist in equine sports medicine and rehabilitation. And one of the projects that was offered to me as a research project was in the repeatability of ultrasounding the equine back. And so obviously the reasons why we do that involved a lot of, I guess, information about back pain and why we treat back pain. And it was a very kind of new technique at the time. But what really got me passionate was that the professor at the time, so Professor Leo Jeffcott, he's a very well-respected but very humble veterinarian who's been highly involved with Sydney University. He was the dean of the vet school previously, but he's also been to multiple Olympic Games, and he won't tell you all this because he is so humble, but he's got the best stories. But anyway, he was very involved in the original research when it came to kissing spines, sacroiliac, back pain, and seeing how he works with the horses, his theory behind everything, how he had one opinion, I guess, when he first diagnosed and found issues with back pain, and then over the years he's adapted and adjusted that opinion as he's seen more cases and more research has come out. It's just very inspiring to be working with him, and I guess a lot of what I learned and a lot of my principles behind back pain and how we manage it originally came from him. So really I can thank Leo for, I guess, inspiring me to become interested in back pain and then kind of, I guess, keep spreading his message.
Oh, I love that. I love that. And it's interesting. I'm sure as a PhD student, I met Leo Jeffcott at a conference at UNE.
I'd say very likely. Unfortunately, he's not quite as involved in everything as he used to be, but for years he still would just pop up voluntarily to be involved with the students. And I think everyone knew of Leo, but to actually get to work with him so closely and spend a lot of time with him and pick his brain whenever we had a weird case where we were like, where's Leo? He'll know this one. So
Yeah, those mentors in our careers are just so cool, aren't they? Like they just know so much.
makes a big difference, inspires, the next generation. So
Absolutely. And then can you tell us, so this is not, I mean, I, as you know, and a lot of people know, am a very specialist nutritionist. So stepping into the area of back pain, I mean, it's involved in nutrition because, we feed the muscles and have some influence on the back. But can you, like, if someone said to me, define back health, I go, I don't know. So can you just give us a definition of what back health actually is in an equine, please?
Yeah, well, for me, there's two key elements that are going to be a component of back health.
Hmm.
And the first one's going to be good muscular support of the spine, which you're going to hear me talk about a lot. But I feel like that solves a lot of our problems and also prevents a lot of our problems. And then I guess the second element of having good back health would be it being pain free, which would like to think is a given, but I guess when I approach it from the cases I see, the first main concern is their pain. So I kind of think, well, a healthy back's going to be one that doesn't have any pain, but it's also going to have that good muscular support. And I guess where that muscular support comes from, it's not just the muscles along the spine and that top line. It's going to be the core strength as well. They do work together. Um, and I guess to try and, I guess, make sure that they're healthy, it's going to be that combination of doing those exercises that focus on these muscle groups, but then you need to ensure they're pain free so that they can do those exercises. And then to complete that triad is to add in the nutrition so that they can then build up the muscle, because even if you're using it properly and it's pain free, if you don't have that nutrition aspect to support the muscle growth, you're still not going to achieve your goals. Um, so that's probably the main definition when it comes to back health itself. And then, I guess you can discuss all the potential different kinds of pain and primary pain versus secondary pain, and where those different things can come from.
Hmm.
But
Hmm.
ultimately, it's making sure that, there is no pain and that we have a good support system there.
That definition sort of boggles my brain a little bit because for me as a nutritionist, often we think of, like, people say, how do I build up the top line of my horses? And often it's an aesthetic thing. They're thinking
Mm.
about it from a very aesthetic, and I'm guilty of this. I mean, I've worked with I don't know how many thousands of yearlings in yearling prep, and we think about their top line and their muscle as like they look amazing when they're really well muscled, and it makes perfect sense. I mean, in humans, our core strength particularly has a big influence on our spine. But when I think about back health, I think of the spine. And is
Mm,
that
mm.
a common?
It's very common, and a lot of our research does originally come from the human research. And so a lot of the human studies have then moved to focusing on when humans have back pain, is that if you have a good muscular support, that spine doesn't move in ways that it's not meant to, and it supports I guess, the joints, because there are some joints along our spine as well, and the bony aspect too. In horses, we see it a lot more when it comes to things like kissing spines, where the spine is a mobile structure, and in a lot of horses, if even though those dorsal spinous processes might be close together, if those muscles are supporting it, then you're not going to get that unwanted movement where they're too close together.
Mm.
But it's when you don't have that muscular support and they don't have the control of the vertebrae that you're going to see more of things like kissing spines developing. And so we now understand that if we are able to achieve a good top line and achieve that good muscular support and then maintain it, we are actually able to treat a lot of different causes of back pain. Unfortunately, it's easier said than done. But it's really come from that human research, and we're now applying it to horses. And if people are able to, I guess, commit to those exercise programs and work with their horses, we are having a lot of success with managing back pain by focusing on the muscles alone.
Yeah, wow. Wow. So this is really cool because nutrition is far more involved than I thought.
Oh, it's the key, and, like, the one as soon as I get the ones where I'm like, "We're doing everything right, and you're doing the exercises right, like, why aren't we winning here?" I'm like, "What are we feeding it?" And then I'm like,
Mm,
"Give Nerida a call."
it makes such a difference what you feed them as to how much muscle you get
Mhm.
in their back, but we'll get to that a little bit later on. So as a horse owner, and this is coming from very much from a personal space at the moment in wanting to be able to pick up early signs of back pain. What are the earlier signs of back pain? Like there must be things that are easy to miss because we're not looking for them as horse owners. And then how do we check? Like what are some practical things we can do to actually check if our horses have got sore back?
Yeah, look, that's a great question because how long is a piece of string? Unfortunately for us, back pain is often presented to us by horses as a behavioral type response.
Uh-huh.
And then the biggest question for us is this behavior related to pain or is this just behavior training? And then to make it extra complicated, is sometimes it'll then become a learned behavior where if
Mm.
we have a horse that's had pain, we've treated the pain, but now they're anticipating it, even though
Mm-hmm.
we've actually fixed the problem, you then get that behavioral aspect to it. So obviously, every horse is going to be a little bit different. Um, and, we also then have an extra element of having cold backed horses, which again is another behavioral type response that they can have. But I guess when it comes to considering what true back pain looks like, the things to consider are lameness. It's not super common in primary back pain issues, but often back pain can actually be secondary, usually to hind limb lameness. And so if you have a hind limb lameness component, that can then lead to that tension in the lumbar muscular area.
Mm-hmm.
Horses can be stiff or they can sometimes collapse when they're being ridden. They might have resentment to grooming, the saddle, even sometimes the farrier, poor performance. The one that gets people the most is dramatic bucking isn't actually usually a sign because it's actually really painful for horses to extend and flex that trunk area if there is pain there.
Mm.
So when you think of horses that will do a big bronc and get their rider off, generally, that's not gonna be a reaction to true back pain. Um, and I guess as an interesting fact, we often find that horses that are a bit more excitable, or like have an excitable temperament can be a little bit more prone to getting back pain, whether they have a lower pain threshold or they're a little bit hypersensitive. We're not really sure, but they seem to kind of have excessive tension or spasming of the muscles. But I guess for things people can look out for, physical exam for us is our biggest component of determining, are they reactive to palpation or not? And we are basically just running our fingers along either side of the spine and gradually increasing the pressure. Obviously, if you walk up to them and start jabbing them in the back unexpectedly, they're probably going to be a bit reactive to that. No, I would be. But it's also getting to know your horse because some horses are going to start reacting to a lot lower pressure than others, and that might be completely normal for them. The thing that can catch owners out is that it is normal for horses to move away from that pressure. That's what we want them to do. So if they don't have back pain, they're going to move their back away from us. When they have back pain, they don't want to move away from that pressure because that's what hurts. So instead, they will tense at that location. And so we actually want horses to be dipping away from us to a certain extent. Once we kind of get an idea of if there's tension or not, the next, I guess, thing to look out for is the behavioral response because sometimes I'll get horses that have tension and you feel the muscles almost spasm, but I don't get the behavior response and I consider them milder cases. The ones that have true back pain when I palpate their back, um, try to hurt me. Like they put their ears back, they're like baring their teeth at me. They might properly try to have a good kick at me. Like
Mhm.
those ones, I'm like, yeah, you're sore. Well, the ones that can carry tension don't necessarily have that overreaction to me palpating their back. So it's kind of getting used to what's normal for your horse and then trying to determine like what reaction is considered tension, what reaction is considered true pain versus what reaction might actually be normal. And that
Mm.
does just come with experience of actually going, I've seen horses with true back pain and this is what they've reacted like.
Yeah, it does sound very much like something where you would have to put your hands over a lot of horses to be able to
Yes.
pick up those really fine
Yeah, yeah.
differences.
And it is interesting because once you kind of know what they might look like once you've taken x-rays or like kind of what you're expecting, it then helps, you develop a bit of a scale in your head as to what you would consider normal versus what you get concerned about.
Okay. Now, there are a few things there that I'd love you to go back and just
Yes,
define for us. So,
yes.
primary and secondary back pain. So, you've mentioned there's a secondary back pain if they've got hind limb lameness. And is that because if they get secondary back pain, they're not moving their hind end normally and then they're overcompensating with their back muscles and making their back muscles sore? Is that what you
Yeah,
mean?
yeah,
Okay.
100%. So secondary back pain, so essentially the origin of the pain is coming from somewhere else,
Mm.
is most commonly due to hind limb lameness. So I see it a lot in horses with hock arthritis. There's a certain location just before you kind of get towards your sacroiliac area where they can carry a lot of tension. And it's exactly as you said, they're compensating for having that hind limb pain and they're trying to move those forces somewhere else. And that's what creates that back pain. And so ultimately, fixing that hind limb lameness should then remove that back pain, but I still like to address that to a certain extent because, it will take some time for everything to catch up, even once you've treated the hind limb lameness. While primary back pain is obviously the origin itself is coming from the back, and then you can kind of divide it up into muscular causes, which could be trauma. So your saddle fit's a big one. Horse rider mismatch is another one. Also muscle strains and tears, which are a lot less common than people think. And then basically poor muscle development. And then you got your primary spinal causes, which are going to be your kissing spines. So on your vertebrae, there's a thing called a dorsal spinous process, which is a bit bone that sticks up. It kind of is what makes up your withers, and they can be too close together and then rub against each other and cause inflammation. Or you can actually get arthritis in the facet joints along the spine as well.
Okay. There's so many ways to back pain, isn't there?
And then you got all the behavior training, cold-backed type horses, which is kind of another element itself.
Yeah, so that was another one. So I've heard that terminology quite a lot thrown around, cold-backed horses, but I've never heard someone say it who is in your position, a specialist in back medicine. So can you explain cold-backed horses
Yeah,
to
of
me?
course. So when we think of cold-backed horses, they're generally horses that don't have any underlying pathology along their back, but often when the rider first puts a saddle on or when they first mount, they can be a little bit reactive. They can extend or flex their back a little bit when their, rider first moves off, or the rider might describe them as being stiff along their back. But the signs generally disappear as the back warms up. So
Mm.
really within a few minutes, and within, I guess, the definition of cold-backed horses is that it doesn't affect performance. So it's almost like there's a stiffness, reactivity to the back at the beginning of a ride, but it doesn't affect performance and it goes away in a couple of minutes. And so with these horses, the main focus is essentially making sure their backs are warmed up prior to being ridden. You can do that. I've seen some very fancy stables that have these big heat lamps that they
Mm.
tack the horses up under. It'd be amazing if we all had those.
Mhm.
But even if you just had different kind of like heat packs that you could like put over their back to start with, or just make sure you give your horse a good warm up at the start of the session. And that's something that there's kind of no pathology for us to target treatment at.
Mhm. It's a little bit like when I hop out of bed these days and my ankles are like, "Ooh, ah, ooh, ah, ooh, ah."
Yep, yep, that's exactly like that. But once you get going and get to your coffee, you're fine.
Yeah. That's exactly how it works. By the time I get to the kitchen, I'm all good.
Yeah.
Uh,
Uh,
and then there was one last one, and I don't really wanna ask this question because I'm afraid that it's the answer I don't wanna know, but you said they collapse when ridden. Do you mean like they literally collapse to the ground, or they
no.
knuckle over at the back?
Not
What
kind
did
of
you mean
knuckling over,
there?
it's more like, they almost like dip in their spot. Like you kinda go through certain movements and it feels like the horse is
Oh.
kinda moving away from you.
Oh,
So
okay.
they're not kinda collapsing, completely falling over, but it's like they've had like a reaction to something you've done and they feel like they're dipping away.
Yeah, okay. So tell me, when some horses that you ride, and my daughter's horse does this, and it was one of the questions I wanted to ask you. When they'll be cruising along, usually
Mhm.
trotting, and then they'll knuckle over on one of their hind legs, and they sort of like they sort of drop down, like one of their hips will drop down and then they'll go again. What is that? Is that anything to
Yeah.
do with back pain?
I think it's probably less likely to do with back pain. I have had a couple of strange cases doing this in the last year, to be honest. I reckon I've had 3 cases of it, and I've never seen it quite as commonly. They've all been slightly different things. Some of them have had some arthritis that we seem to have managed and treated away. Sometimes I worry, particularly in the hind legs, if there's a weakness aspect to it where they've kind of gone to do something harder or they've had a bit of a muscle spasm and that's just caused that reactivity for them to kind of collapse underneath themselves. I had one that had locking stifles that was doing that, and we treated
Mm.
the locking stifles and that helped. But unfortunately it's not really a distinct sign for one thing or another. There's a few things it could be, but generally I often end up, and I can talk about this now or I can talk about it a little bit later, is when it comes to back pain, but also any kind of strange behavioral type thing that's not consistent,
Mhm.
we end up trying to go, is this pain related or is this behavioral training weakness? And one way we can do that is to do something like a pain relief trial or an anti-inflammatory trial where we put the horse on pain relief for a couple of weeks. We do everything as normal and we see if the behavior goes away. And if it does, it might not go away 100%, but if there is a dramatic improvement, then it's more likely that there's pain and we need to chase whatever that is. If the
Mm.
horse is exactly the same, then it's more likely either behavior training or weakness, because basically making the pain go away hasn't made a difference. So it's less likely to have a pain origin.
Okay, that makes sense. I'll have to try and catch this horse doing it on a video and send it to you and
Yeah, no,
see
definitely do. I'm very interested.
see what you think. So we've answered. My next question was, which are the most common musculoskeletal problems you would diagnose and treat? Which you've probably answered quite a few of those. So let's combine that with what also are the most common avoidable risk factors for back pain that you'd love every horse owner to audit in their management system.
Yeah, we can combine them. Yes. So when it comes to, I guess, avoidable risk factors, or I guess one way we can kind of target it is things that an owner can do, I guess, before a vet may see the horse, or things that they can do to try and, yeah, I guess, avoid it is first thing is your saddle fit. So that's your trauma.
Mm.
If there's a trauma aspect, that's something you can remove at home. You can get your saddle fit checked. And it's important to get it done regularly because your horse is going to be constantly changing shape, depending if it's in work, if it's not in work, if it changes the type of work that it's doing. So even though you might have got the fit checked once and it's been perfect, it's worth getting it rechecked again, and make sure you trust your saddle fitter as well and have someone that's, got a good reputation and you're happy working with. The next thing that they can do to, I guess, try and avoid the risk factors is maintaining that good top line and building it up properly. If you lose it, if you don't use it, you lose it. So you need to be maintaining it, and the key is doing the exercises properly. The biggest mistake I see people make is that they think they're doing the exercises right, but they're just going through the motions. And I explain it as it's like us going to the gym. You might be reading a program and you're like, that's easy, I can do that. But your body will naturally try and find the easiest way to do it. And you might actually be working your muscles properly. When we're working with our horses, it's the same thing where you kind of need to be the PT that's there telling you how you should be doing it properly so that you are making sure you're actually engaging the right muscles. Otherwise, it's very easy to think you're doing everything right and your horse is going through the motions, but it's actually avoiding doing the exercises properly.
Mm.
So that's one thing that you can get on top of at home that will definitely help prevent back pain developing. The other thing, I guess, is that hind limb lameness that we spoke about. If you have things like toe dragging or you're concerned your horse doesn't feel right behind, if you're able to address that hind limb lameness before they develop that secondary back pain, then that's, I guess, one less step that you have to worry about because you've treated it before it's even happened.
Mm. It kind of becomes I imagine it would sort of become a self-fulfilling prophecy. Like if they get some, say they've got hind limb lameness and then they get
Hmm.
back pain and then they're not using their back muscles properly, so they get back muscle wastage and then it starts speeding itself. Yeah.
Yep, I see it a lot with horses that have either hock arthritis, and Another, I guess, issue that we have that's also related to muscle mass is locking stifles. And I see it in both back pain and locking stifles where a horse has some sort of pain, so often hock arthritis, they've stopped using himself properly. The owner has then noticed either that secondary change, so whether it's locking stifle, whether it's the back pain, and then they've come to me with that complaint. And then we've actually had to kind of follow this little path and going, actually, this is our primary thing for us to address. We'll still help those secondary things while we're addressing that primary issue. But if we obviously don't get on top of that, those secondary issues, we're just going to be going in cycles trying to get on top of them.
So in terms of avoidable risk factors, there's a couple that I often wonder about. So one of them is feeding from hay racks. So I work in big stables, and I'd really love to have it illegal to have hay racks that are up like you're feeding a giraffe. But so, you're taking these horses that have evolved for 55 million years with their noses on the ground, and then we're making them eat like they're browsing animals for quite a long proportion of the time. Is that likely to cause issues with back health?
Not particularly for back health itself. I'd much prefer horses to be in a neutral position or off the ground, but otherwise, there's kind of no research, I guess, associating with head position being raised and affecting back pain. But we do know that having their head raised is a reason why some horses don't develop good top lines. So for them to develop it properly, they really should be in a rounded frame and engaging that core and engaging that back. And the horses I commonly see that have this issues, if we let them go on the lunge, and I'm just watching how they move naturally, and a lot of thoroughbreds do it, is they stick their head up in the air, they hollow their back out, and they're not using it at all. And those are the types of horses that really struggle to develop top line because naturally they avoid it. So I guess it'd be reasonable to consider that if they are eating with their head up, that is creating that hollowed back position, and it's not going to be doing them any favors with trying to, I guess, maintain and develop that muscle mass. I don't think it's necessarily going to lead to them getting back pain, but it could be a contributing factor when there's so many different elements that are potentially involved.
And you wonder about like just that grazing position, like they're using their head and their neck obviously to collect their pasture, but there's got to be back involvement in that too. And if they're meant to be doing that for 18 hours a day, like it.
Yeah, for sure. And I think ideally, as much as possible, even just being out on pasture is going to be beneficial because they're going to be walking around. There's going to be, potentially natural hills within the paddocks. They're going to be moving their head up and down. And I also say creating incidental exercise is also really beneficial. So you can put just some poles out in the paddock where they're going to walk up to get to their feeder, or you can put multiple hay nets around the paddock so they have to move around more. And there are all ways that you can incidentally try and create exercise and movement for your horse. And we know more for locking stifles than back pain, but rest is the worst thing you can do because they're not going to use those muscles. And putting horses that have locking stifle in a box is always going to be very detrimental because they stand still and that's when they lock. So we need to keep them moving about.
They were never designed to stand around.
No, not at all.
Hang on 2 seconds. I'm just going to let a dog out. Just sitting here. We just did a podcast with Brian Nielsen from Michigan State and his grad student Renee Harboe, and we were talking about joints and joint supplements and things, and something that I'd never thought about, amazingly, is that cartilage doesn't have any blood supply to it, and it relies on movement to sort
100%.
of smoosh nutrients through. So this is all part of that, isn't it? Like they were never meant to stand still.
It really is, and that's why joint health and any horse that's got arthritis, particularly older horses, the more we can encourage them to move, the better. And you obviously adapt their workload based on how much, their joints are able to maintain, but they need that nutrients in the joints and also they need that muscle support to the joints. So I much prefer people to say have an older horse doing a little bit of light work every single day or a little bit of trail riding and staying in work than those horses that are just put out in a paddock and then they just lose all their condition, they lose all their muscle. And in some cases, I know it actually can make it worse.
We have a very old mare here who I seem to mention quite often, but she's in her mid-30s. Our vet looked at her when she first arrived and told us that we'd maybe get 6 months out of her because her joint health was so bad. She all sorts of big knobbly bits and pieces on her hocks, and she's done lots and lots and lots of time under saddle for lots of people over the years, I would imagine. That was 4 years ago. And she lives out, or 4.5 years ago now, but she lives out in a 30-acre paddock, and she moves around a lot, so she follows the younger
Amazing.
horses around. And I said to my daughter the other day, I'm like, have Breeze's joints improved? Like, they're not, they had, I don't know what you call them, but like big sort of fluidy, puffy bits on her hocks and
Oh,
things.
yep. Yeah, yep.
And that's gone away.
Oh,
Oh,
great.
it's just, it's crazy.
We'll
But
take the win.
yeah, but I think a lot of that has to come down to the fact that she moves. So she's not ridden
Mm,
anymore, but she moves so
yep.
much because
But
she wanders
moving
around
around.
following the other horses. Yeah. So what can we all do? Because there's so much we can do. I mean, from a nutrition perspective, there's so much horse owners could do to keep their horses healthy, but there must be things that we can do daily, weekly, monthly, annually. What you mentioned, getting your saddle fitter to come on a regular basis. What are
Yeah.
some of the other things that we can do to keep our horses' backs healthy?
Yeah, so I think when it comes to things like your exercise programs, an important thing to do with those is to make sure that you're adjusting them as well as maintaining them. So obviously, you need to spend time building up the muscle, and then once you've spent all this time and you've worked up and you've built it, if you don't maintain it, you're going to lose it. So there are different ways that you can then be adding in exercises to keep things interesting for you and your horse. It's going to get boring for you both as well. But it's like if you did the same exercises at the gym every single week, it reaches a point where you're going to hit a static amount and you're not going to be gaining anything else or changing anything else. So
Mm.
whether you add some, so the first thing would be maintaining all that hard work you've just done, and that's either by adding some exercises to the start of your normal program, so whether that's 10 minutes of exercises, or at the end of the program, or incorporating some of these exercises into what you're already doing. So the key exercises I recommend is working in a frame and making sure you're doing a lot of transitions. So transitions up and down are beneficial. If you're ridden and you're doing a lot of dressage work, you're going to cover that a lot anyway. But if you're lunging, then put your horse in side reins, a Pessoa system, whatever system you like. And then trot piles is also beneficial. So raising their legs and making them engage their core. And then also your carrot stretches. So there are studies that find if you do your carrot stretches, I think it's each stretch is 5 minutes, 5 times a week for 5 weeks or something like that. I just remember 5, 5, 5. It does show that it'll help improve those core muscles. So you can also incorporate that in once a week, a couple of times a week at the start of your session as, again, like a warm up, and also your heel work, which is more beneficial for hind end strength than spinal back strength. But if you're looking more as a general maintenance for your horse, heel work's going to be very beneficial for building up and maintaining that hind end. And then the next thing to do is to mix it up so that your muscles keep getting challenged. So the main way to do that is either with frequency, so how many times you do it a week, or the difficulty of the exercise, so how many repetitions you do, or how long you do it for, or the level of the exercise that you're doing. And so you can pick any of these to change it up, whether you're doing it more frequently, for longer, changing your exercises, making it harder. But that would be a way to help maintain it and keep building up the muscle, even when you're not focusing on a strengthening program per
Mm.
se.
Mhm.
And then, like I said previously, things like your incidental exercise in the paddock, that's always going to help you out with the trot piles, and then making sure your saddle fit is regular, because every time you're building your horse up, every time your horse has a rest, every time you change it, the muscle's going to change. So your saddle fit will change. And it's key not to just keep adding pads and things to your saddle. So research into, I guess, pressure points of saddles have actually found that by adding different pads and trying to thicken it up actually can make those pressure points worse. So
Mm.
it's important that you actually have a saddle that just fits properly and fits your horse properly. And some indicators that it isn't, that might not necessarily be back pain, would be things like white hairs developing. There's these little firm lumps you can develop. They're called eosinophilic granulomas, but essentially they're like almost like little saddle sores, and they can be an indication that your saddle's not fitting properly. Or one thing I say to do is check your saddle after a session. Either look at your horse's hair or look on your saddle pad, and you should have like an even distribution of sweat there. If you're finding that there's different sweat patches and dry patches, that can be an indicator that the different pressure points isn't even across your saddle, and it's
Mm.
probably worth getting it checked.
Mm-mm. I'll add some symptoms of a saddle not fitting well, because we had this last year with Toma's little mare Popcorn, who's like incredibly muscly little Australian stock
Popcorn.
horse. She named her when Tama was 2 and Popcorn was about 2 days old, and she'd been foaled down on a thoroughbred stud in the Hunter, and we went to pick her up. I said to Tama, "What would you like to name?" Thinking, oh, this could be anything, asking a
Yeah.
2-year-old. We hadn't talked about names, and she just walks in and goes, Popcorn. So Popcorn it was.
I
But
really think Popcorn was a win then.
oh, it was so cute. But she's a mare that will tell you what she thinks of you at any point in time,
Mhm.
and amazing to ride though. Like, she's so willing. But she got to the point. So Tamaya was riding in a jumping saddle that I'd been given as a 17-year-old, and when we eventually got a saddle fitter out, she laughed and she goes, "Oh, look, it's an antique." I'm like, oh, steady on there. That was mine when I was a kid. But she got to the point where she just didn't want to let Tamaya get on her. So she wasn't, we weren't
Mhm.
brushing her or feeling her back or anything and going, oh, wow, she's really sore. But she's obviously going, when you hop on, it hurts me and I don't want you to hop on.
Yeah. I distinctly remember one client seeing me for back pain, and I said, "Bring your saddle along and let's have a look." And as soon as she went near the horse with the saddle, it was like bolting the other way. And I was like,
Yeah.
"Oh, wow, that's a very reaction. Sees that saddle?" And it was like, "Nope, not going near
Yeah.
me with that."
Yep.
So,
Yep. And then we then got, and I grew up riding in fender saddles and Australian stock
mhm.
saddles. So I didn't even understand the concept. It's embarrassing to admit this, but I didn't even understand the concept of what a saddle fitter did, because I'd never had a saddle that you could pull a bit out of and put another
Oh,
bit
oh,
into.
100%. I think back to my first horse and the amount of times he bucked me off, and we never got that saddle fitted. And now I look back and go, did that saddle just never fit
Mm.
him properly? No wonder he
Mm-hmm.
was chucking me off all the
Mm.
time. Like,
Yeah, because
yeah,
you
no
just
idea.
got a saddle, and that
Yep,
was the saddle
yep.
that you
Got a
rode in.
saddle, put it on the horse, off you go.
Yeah, yeah. So now, we had that saddle fitted to that horse, and then she's moved on to this thoroughbred now. So we had the saddle fitter out the other day to change the saddle to the thoroughbred. And then, like you're saying, I'm watching this thoroughbred like rapidly muscle up,
Hmm.
which is really, really nice. But I'm thinking, oh man, it's not going to be long before we have to get that saddle changed again, because she's just changing shape so quickly. But
Yeah.
yeah, they sometimes will tell you, but then other horses are so
Mhm.
stoic
Oh,
that
yeah.
they won't say anything.
Yeah, 100. And then
Mm.
sometimes the ones that are really hard, because also by the time they're telling you there's a problem, it's a proper problem. So
Mm.
it's a fine line between having them be a little bit tough, because I think you do have to be tough to be performance animal, but then also letting us know so we can help you early
Mm-mm.
on.
Yeah, you got to be really, really aware when you've
Mm.
got some of those tough horses, that this thoroughbred mare, she's tough. Like, will have a hoof abscess, not even lame.
Yeah, well, yeah.
So she's really good at hiding. I guess as a prey animal, they do hide their pain
Yes,
responses, so they're not the ones that get eaten.
get
But
in 100%.
with her, we have to be really careful that, there's not something going wrong and we don't
Mhm.
know about it because she's hiding it. But now, can you give us we talked about exercises, up and down transitions. Practically, what does that look like? Just really briefly.
Yeah, so what I might say you've got them on the lunge, you might do 5-minute walk one way, 5-minute walk the other way, 5-minute trot one way, 5-minute trot the other way. So it's not necessarily going up and down, up and down, up and down, but it's just making sure that you are having that time, or even not in 5 minutes, you could do 5 circles, that they're kind of stopping, going the other direction, but it isn't just trotting for 20 minutes, it's not stopping.
Mm.
It's go walk, trot, or
Mm-hmm.
up to cantering, through some cantering as well. But making sure that they're spending time between the different ones, so they have to transition up and have to transition down between the different gaits. That's going to be beneficial, because each time they do that, they're going to have to be engaging their core and their back to be supporting themselves,
Mm-hmm.
if they're using themselves properly. And that's why, particularly in a lunge, things like the solar system are going to actually make them engage and use themselves and not fall out of it per se.
Mm. So in being ridden, well, really never lunge horses
Mhm.
here, but being for ridden horses, like, it's just the
Mhm.
same thing. Like, just
Yep.
like
Yep.
transition up, down, and it doesn't matter how quickly you do it or how slowly you
Mhm.
do it.
Yep.
If you're walking, you can walk for 5 minutes and then go into trot, and then
Yep.
yeah,
Yeah, 100%.
as long as there's some variation, is that
Yeah, as long as there's some variation and that they're engaging the hind end and that they're in a frame as they're doing it. So it's
Hmm.
when they, as much as we love like long and low to try and get them to be relaxed and moving out, they're not going to be engaging their core when they're doing that. And same with
Mm.
the horses that chuck their head up high and
Hmm.
try and hollow out their back. So as long as they're making sure they're in that frame and that yeah they're going up and down, that's going to be beneficial as well.
Hmm. Okay. And then trot poles, how do we set up trot poles so that we can
Oh,
do
however you
exercises that
like.
okay.
Basically, as long as they're having to lift up their legs, they're gonna be engaging their core. So you can even do it with water. If you're lucky enough to be by the beach, take your horse to the beach and ride it through the shallow water. As long as they're lifting up their legs, they're engaging that core. So you can have fun with it. You can do all your different patterns. You can even just start off walking, progress to trotting. It's just making sure that they are basically lifting up their legs.
Mhm. And then the cavalettes, like, slightly higher,
Yep,
is
yeah,
that
you could progress you
as good
progress the
or
cavalettes. You will reach a point where if you're getting too high, you're probably not gonna see the benefit quite as much once they
mm,
kinda go from that true just having to, engage their core to lift the legs up versus jumping.
mm,
So some low cavalettes are okay, but once you're kinda getting a little bit higher, the benefits of focusing on that core are probably not gonna be quite as strong.
okay. And then for people like me who don't know the carrot exercises, is there a
Yes.
couple that you can teach us?
So it's very hard to do on podcast. I tried doing it in a webinar once and I ended up just getting a whole bunch of videos because it's easier. But you can YouTube it and there's a whole bunch of YouTube videos. But essentially it's when you're using a treat to move their head into different positions. And so there's some where you're basically putting their nose down between their legs and towards the front of them. And then you've got some lateral or side to side movements where you're then having different points that you're aiming at where you're using the carrot to get them to flex their head in a certain position. And the goal of that is when they're moving their head in the different positions, they're having to engage their core and their top line to support themselves as they're doing that.
Mhm.
Again, you got to make sure they're doing it properly. So it was actually quite fun filming the video for the webinar because the horse hadn't done too many of them. And so some of them he did really well on his own. And then a few of them he was showing us all the little tricks that you do to try and avoid doing it properly. So
Mhm.
twisting their neck certain way, or they might go stepping to try and get to that carrot. And it's making sure that they don't do that. But you start off slow, see what your horse can do. It's always quality over quantity, because if you can do a few of them right, you're going to achieve a lot more than doing it wrong for a very long period of
Mm.
time.
Mhm. Ah, awesome. So we can have it is your webinar available somewhere on YouTube
I'm
or
not actually sure. It may be. I can have a look and send you the link if it is. I know it was available on the university website for a little bit, but I'm not sure if it's still up.
yeah, okay. All right. Well, if we can find it, we'll put it in the show
Yeah,
notes
for
and then
sure.
people can watch that. That'd be awesome. And then he'll walk at any pace, walk, trot, canter, or is
Yeah.
one better than another?
So it depends on where your horse is at. If your horse has active back pain, then we usually do cantering last and we'll focus on the walk and the trot. There are some people who support walking over trotting. I think it really depends on your horse's individual fitness and where they're at. But if I have a horse with active back pain, I start with walking, trotting, build them up first, and cantering will be the last thing I'll add into it, as that's going to be the one gait that is going to put a bit more kind of strain on their back. And so
Mm,
when I'm assessing a horse to see if they naturally use their back a lot, I'll do it at a canter. I'll just either free canter them or canter them on the lunge without any systems to see if they naturally want to engage it. But while we're building it up, if there is any pain, we'll stick to walk and trot.
okay. And again, in the proper frame, not with their head up and
Yeah,
their back hollowed out.
yeah.
Yep. Yep. Cool. Now, if a horse does have back pain, does any of this change? Like, do you do different things for a horse that's already got active back pain, or is it as similar?
Yeah, so it's definitely similar, but the main thing first is removing the pain element because if there's any pain, they won't use it properly. And how we do that, there's a whole different variety of ways, which really depends on what the underlying cause of the back pain is. So if it's something like trauma from the saddle, initially we might actually get the saddle and the rider off the horse and we'll do the exercises just on the lunge or on the ground. Or if it's significant back pain, we may do that anyway. The next step would then be the variety of options. So you've got your systemic pain relief, so things like your non-steroidal anti-inflammatories, so your bute, your flunixin. My preference is generally bute for musculoskeletal conditions, and we'll put them on a course of that just orally for a couple of weeks. If the horse tolerates that, fine. The other options would be a local injection at the site of the potential pathology, so kissing spines or arthritis in the spine, you might inject a steroid at around that location to provide some local anti-inflammatory effects. Shockwave has got a fair bit of evidence supporting its use. So that's, if you haven't seen one before, it's when there's basically these waves of energy are released into the back. It's called a shockwave because it's like a pressure, like a sound wave. It's very loud, and it is known to actually basically numb the area for about a week. So you can't use it, I think it's 5 days prior to competition. But it is definitely been shown to help in horses with back pain and provide pain relief to that area by affecting those pain pathways to the brain. So you could do shockwave. Acupuncture also has support to help with back pain and manage back pain. So we do recommend acupuncture. There's something similar to acupuncture called mesotherapy. There's a lot of less evidence to support it. Anecdotally, I've had some clients love it and some clients don't think it does anything. So I leave it up to the client if they want to try it, where we basically do a whole bunch of little injections under the skin. There's different recipes people use, but usually there's saline with a bit of local local pain relief as well as a steroid. And that again is another way that's meant to break that pain pathway to the brain. And so they're kind of your main options of different things you can do medically to try and provide the pain relief. And then from there, depending on their level of fitness at the start and the level of top line, I usually recommend a 6-week strengthening program as a starting point. And the goal of that program would be to be working them 5 times a week up to about 25 minutes a session. And so obviously it is always a bit of a hard one because the more you use it, the quicker you're going to build it up. But we also need to get through that pain barrier. So initial goal is remove the pain barrier. Then we need to try and do as much work as we can to try and build them up, but take into consideration that quality over quantity. So if an owner isn't able to do the exercises that frequently, completely understandable, life. If the horse is not fit enough to do it, that's also another reason that we might have to go slower. But I just warn them that if we either can't do the sessions for as long or we can't do them as frequently, be prepared it's going to take longer to build up that muscle. And so don't expect a 6-week will be at the same level as someone who's done it 5 times a week, 25 minutes. It's just going to take a bit longer.
And then is there high risk then of reoccurrence of the pain when we do it slower and don't strengthen those muscles?
Potentially. I guess it's more a matter of the strengthening is going to help maintain and prevent the pain depending on the cause. And so our pain relief options will start to wear off in that time. So I obviously don't want them on systemic, so like bute, longer than they have to be. So ideally, we don't need to give it after those 2 weeks. Same with our steroid injections, depending on the severity of the disease. It depends on how long we're going to get a good effect from them. Same with our shockwave, we know we get about a week, and then depending on how frequently we're getting acupuncture and mesotherapy done, also depends how long that works. So if we do it over a longer period of time, that pain is more likely to come back within that strengthening period, and so we might have to repeat those pain relief methods.
And what is the point? So if we've got a horse, everything, I think this horse has got a sore back. What is the point where we go, I need a vet here to look at this and a vet to become involved?
Yeah, that's a very good question. So the first step, I guess there's certain information that we can get that's going to help us that the owner can get before they bring it into the vet. The saddle fit's a big one. Get your saddle fit out so we know where we stand with that before we get started. Another thing, it depends on how well you know your vet. I like to do my 2-week anti-inflammatory trial to get an idea on the pain versus behavior aspect. And it depends on how well I know the client, how well I know the horse, as to whether I do that before I see them or whether I see the horse first. Because the one thing I want to do as well is make sure there's nothing I'm going to make worse by doing the bute trial. So often I'll see them, rule out any kind of significant lameness that might be missed and that might need to be treated and be a reason why we can't do the bute trial. And if I'm happy that the horse is essentially trotting up fine, there's no signs of lameness that could be causing it, we then go do our 2-week bute trial, see what response we get to that. And then at that point, we definitely need to see the vet, because all the rest of our information, we essentially then need to do diagnostics such as x-rays or ultrasound to see what's going on. And then we obviously have a lot of other professionals that can help us out, and they're probably most important for this kind of maintenance aspect once we've done our initial pain relief treatments. So your muscle workers, your physios, they're going to be really beneficial for when you're maintaining that muscle, because like us, if you're going to the gym a lot, your muscles get sore, and a massage is going to help you maintain that muscle and help those muscles recover quicker.
Mm.
And some of these professionals can also do acupuncture, which is going to be beneficial as well for helping to maintain that pain relief for your horse. So I don't tend to use them per se prior to seeing the vet. If you regularly get a body worker, physio out, they can definitely let you know areas that are carrying tension, which might be a new development for your horse, and that is important information for us, but they shouldn't be diagnosing problems per se. So it's good that we get the diagnosis, and then they're going to help us track it over time and also help us maintain those muscles. And that's why they're useful to come in at that point there.
It's one of those things, isn't it? That, I mean, I guess in our experience, our experience was, we had a horse that was grouchy, and then sat up at a came and went and she could feel that the horse's back wasn't happy, and then there was a case of, well, let's see if it settles, and it did. We changed the saddle and obviously took the thing that was aggravating the back away. But had that continued and it didn't get better, then that would be like, oh, there's something.
Yeah, and the thing I feel bad about is I'll often get owners come to me and they're like, I've just spent all this money and I've had all these different people out and we haven't got the answer yet, and you're kind of my last resort. And I feel really bad for them, because I'm like, if you come to me first, I would have set you up with a plan and we could have involved all these people if that's what you wanted. But I feel like you've spent this money trying to treat and you don't know what the problem is yet. You're treating the symptoms, but you haven't actually got your diagnosis yet. Well, I can get you that diagnosis so that we aren't just treating the symptoms of it. We can treat the core problem, and then they can help us maintain from there.
So if someone does have a horse and is listening to this and does have back problems that they can't get to the bottom of, can they get to you at the university to have you work with their horse?
Yeah, 100%. Yep. So I'm based at Sydney University, so you can call me up and I consult at the clinic Monday to Friday. But I also do trips out to Canberra to some of our Canberra clients. So I go out there once a month, once a fortnight, depending on demand. But we definitely, we definitely can see people with anyone that's got concerns with back pain. I'm happy to chat to them to kind of help guide them in the right direction if that's what they feel like they need, or if they're a bit too far away to come in. And I also have a good team of ambulatory vets who can go see horses in the field if you're not able to bring your horse into the clinic, and they will run ideas past me and discuss cases with me as well. So I'm happy to help guide them if you're more of an ambulatory type case and can't bring your horse to the clinic.
Awesome. That's great. So if anyone's got a horse with serious back problems, you can track Nicolle
Give me a
down.
call.
That's very cool. So we'll get to a question on nutrition now, and where nutrition fits in. My biggest experience, I guess, with back pain is in racehorses. And I'll be shown racehorses with the question of, how do we get these horses top line to build up? And almost without fail, where there's like quite dramatic loss of top line. I mean, just for me, who's got no experience in this at all, I can feel that horse's back and go, this horse has got a really sore back. It can hardly stand being touched. And you can see like the muscles are just wasted away. So I can't do anything that with nutrition. But say we get to the point where we can solve that issue. Nutrition then comes in to kind of save the day in some ways.
100%. So like I said, it's kind of like, in my mind, it's a triad of remove the pain, build the muscle, feed the muscle. And so nutrition is so important. I'll leave you to the specifics of what we should be feeding them, but it's definitely nutrition is so important because if we don't feed those muscles, we can do all those exercises, but we might not be developing them because we're not feeding them properly. So we really need those three components of make sure there's no pain, making sure that we're doing the right exercises and doing them properly, and that we are then feeding the muscles so those exercises can actually achieve what we want them to achieve.
Because the source of protein that we use in our horses' diets makes a massive difference to how much muscle they will build. So
Yeah.
if you're using a low quality source of protein that doesn't have enough essential amino acids, you can feed lots of protein and build no muscle.
Yeah. Yeah. And I've had clients come to me and they're kind of going, oh, but I've added protein, I've checked, I've got this. And I'm like, you need to talk to Nerida. It makes a difference what protein you're feeding. Please give her a call. She's going to help guide you in the right direction. Because I'd like you're doing everything as you think it should be done. And, on the surface level, it sounds like you're doing everything right, but we're obviously missing something here. And Nerida's going to help us find that.
So probably my best tip is when you're feeding horses that you are really trying hard to build muscle protein on, don't use feeds that just list vegetable protein meal. Because more than likely in Australia, it's going to be a reasonably low quality protein or something like cottonseed meal that has got, very poor lysine availability. So it's really, really hard to build muscles. So those feeds are perfectly okay for horses who are not needing to do a lot in terms of building muscle or feeding foals or things like that. But when you don't know what the source of protein is in a feed, it becomes very difficult to manage their diet. And then the other thing you should do is use the Happy Horse, My Happy Horse nutrition app, so that you've got, because you can't build muscle unless your diet's perfectly balanced. Because it relies on
100%.
so many things. You've got a zinc deficiency, you won't build muscle.
And it sounds like there's some tricky marketing happening out there as well to make things a little bit extra complicated.
Yeah. Well, I mean, it's not even tricky marketing. I mean, I agree with you. There is some marketing that I shake my head at, but there's just so many products. It's so many products, and
so
it becomes
confusing.
so hard. Yeah. And a really simple thing people can do too. So if you've gone and done the exercises to build up back muscles, after you have done that with your horse, come back in while you're unsaddling. You can give your horse just some loosened chaff or alfalfa. For those of you who call it alfalfa, mixed with some soybean. So really high quality soybeans. So properly processed soybean meal or a properly processed full fat soybean, and then it's like a whey protein shake for a bodybuilder. You go to the gym and then you have your whey protein shake. Do you build up your back muscle exercises and then eat some really high quality protein, and that'll help.
Is
as
timing
well.
also important? Because I know with humans, they do say to get it in within what's about half an hour after the exercise to get that nutrition in. Is it the same with our horses?
I don't think we know with the same degree of
Yeah.
accuracy whether it's the same, but I will still say to people, like, if you can get it into them within the first half hour to hour after you've finished working, like, there's no harm in doing that. And
Yes.
it's potentially, I mean, our muscle systems are so similar. Nearly every animal muscle has the mTOR pathway, and it gets switched on by leucine, so it's all very similar. So I would imagine that there's probably similarities in timing as well. But we did a podcast together specifically on Topline, and I will find a link to that and put it in the show notes of this one, so that if anyone wants to go and listen to that one, they can. And we obviously talk a lot more about nutrition. So we've just talked a lot about back health. If people can only remember 3 must-dos for back health, what would they be, Nicolle?
It could be remove the pain, build the muscle with good quality exercises, and then feed that muscle.
Okay, very good. And 2 biggest things for removing pain? Saddle fit?
Saddle fit, and I guess it depends on what the problem is.
Or preventing
We'll get a
pain, I guess.
diagnosis.
2 biggest things for preventing pain.
Preventing pain would be saddle fit, and then supporting that spine with good muscle.
Okay. Yeah, well, it's I love doing these podcasts because there's always things. So, with Brian it was the joints and having to, move them so they're like a sponge and move the nutrients through. I was like, oh, I'd never really thought about that in that much detail. And this one, yeah, just how important. I mean, top line muscle looks beautiful, but it's so functional.
It's so important
Mm.
functionally as well, and
Mm.
and it isn't even just the muscle itself. I never registered, I think, how much a horse's back actually moves, and we know it a lot from when we take X-rays. If we don't have our horses positioned correctly to take our back X-rays, we can make it look like they've got kissing spines when they don't. So we can make those vertebrae look closer together, and so that's also really important. So it's a very mobile structure, and so it makes sense that we need the muscles there to support it and help,
Mm.
I guess, which directions it's moving as well.
Mhm. Yeah, well, yeah, it's, I love now that I have, lot more reason to tell people that they need to feed their horses for
Yep.
good top line. It's not just because we want our horses to look beautiful. Okay, Nicole, are you ready for our clear round, quick questions with no refusals?
I am. I'm not sure if it's gonna be quick answers, but I am definitely
That's
ready.
right. I love the answers to these questions, so don't feel like you need to rush through them. So, first question, what is your all-time favorite horse movie or book?
This is tough. All-time favorite, 'cause I
Mm.
in fact, 'cause I think back to all the traditional horse movies, your Black Beauty, your Secretariat, your Sea Biscuit, Horse Whisperer. I know growing up, I was definitely a big fan of the Heartland books. I was very obsessed with that series as a teenager, but I actually think my favorite horse movie is probably, Hidalgo, and I don't know if that's the Viggo Mortensen aspect of it or not, but that was definitely a movie I watched a lot. It's been a long time since I've seen it. I should watch that again. But yeah, I think that's probably up there, one of my favorite horse movies.
Ah, I watched that not long ago,
Oh,
and
really? Yeah.
and it absolutely broke my brain because he's in the desert with a pocket full of barley to keep his horse
Yeah.
alive.
Yeah.
I'm like, no, this doesn't work from a
You imagine
nutrition
that?
perspective.
What about the locusts? I'm sure they did something and some
Oh yeah,
protein.
yeah, true. No, he did eat a few locusts, but I think I just couldn't stop thinking about the poor horse's stomach and how much gastric acid, gastric
Won't
acid.
think about the ulcers. Ulcers don't exist in movies.
No, they don't. The other funny movie to watch from a nutrition perspective is the Black Stallion.
Oh, yes. I did
It's like,
remember that
it's gonna
movie.
have iodine toxicity from all the seaweed and
Oh.
it's
Oh,
funny
it's
watching
funny on a
these as
rewatch. Yeah.
yeah,
Yeah.
as an adult to rewatch them. Actually, I'm just gonna jump out of these quick questions and ask a quick question that I
Yep.
should have asked before. Tail swishing. So tail swishing for me, like when it's consistent tail swishing and consistent aggravated, it's such a indication of gastric ulceration for me.
Yep.
Like
Yep.
I
Yep.
look for that. So, but horses
Yeah.
that
Okay.
swish their tails occasionally, just when they do some things, is that potentially a sign of back pain?
Depends if it's repeatable. So I say to people, look out for a pattern of the behaviors that you're seeing. And if
Mm,
we're noticing that there is a distinct pattern, then we try to work out what kind of movements is associated with. And then that's going to help us try and determine what that underlying cause is. So there could potentially be back pain if it's kind of fitting with the other information that you have. But I've also seen horses do it, say, if they do have a particular lameness in a leg and you're making them engage that leg and they're not happy about it. Locking stifles as well, because they find locking stifles not painful but uncomfortable. And I've seen them tail swish with that. And sacroiliac joints too, sometimes when they're asked to engage a particular way behind. So it tends to be more what is the pattern of the behavior, and
mm.
it can just be a sign of pain, I guess, and then it's where's the pain coming from?
Very good. All right, I've got some videos to watch then to see if I can spot a pattern in this particular horse, to see if she swishes her tail for a particular reason. So sorry, that was your
That's
Hidalgo, and my
okay.
brain's gone gastric ulcers, tail swishing. I forgot to
Oh,
ask about tail
there we
swishing.
go. Oh,
What is one myth about back health you wish would disappear forever?
that surgery is a quick fix.
Yeah.
That is something that's been very frustrating, and I know there's a lot of surgeons now who are going away from recommending surgery for it, but I definitely still see a lot of clients who well, they go to a surgeon because they want surgery, and they go to me if they're happy to be open for a medical exercise-based approach. But even if you go to surgery, you still have to do the exercises. And a big question when you read the literature, which everything has a 70 to 80% improvement, is how much of that came from doing the exercises after the surgery versus the surgery itself. And they
Mm.
never go into detail on it. And it is really hard to do studies on rehabilitation, but that's something I would love to do one day is a strong study on it to show how much it's from the exercises and not just the surgery. But
Mm.
people need motivation too, I guess. I know a lot of people won't do the exercises until they've spent a few $1,000s on surgery, and then that's their motivation. But it's very frustrating hearing people going straight to surgery when we can achieve so much without it.
So you're, and I know this is a very broad recommendation I'm asking
Mhm.
for, but it would be to try the exercises and other treatments first, and then
A
if all,
hundred
all
percent.
else fails, then try
Yep,
surgery.
a
Yeah.
100%. I haven't recommended kissing spine surgery for a horse in at least 7 years.
Oh, wow.
Whether some of my clients change their mind and go to a surgeon and don't tell me, I don't know, maybe. But the ones that I've actively worked with and they've been able to do everything properly, my very motivated clients, we've had a lot of success with doing the exercises and the pain relief options alone.
Oh, that's so awesome. It's
Mm.
funny, kissing spine's something that's showed up a couple of times for me recently around like horses having surgeries and stuff. So it's so nice to know that there's actually something we can do that is
Yeah,
not surgical and it's
a
not,
hundred
you
percent.
know.
There's medical options out there if you're prepared to commit and
Mm.
and do the work.
Mhm. If a horse's back could send a push notification, what would it say before a ride?
Oh, use me properly.
Love it. Love it. Love it. If you could ride any horse, past or present, which horse would it be?
Hmm. This is tough because I keep thinking of these famous horses that'd be really cool to be able to say that you've ridden. But I also, having worked with some very high level horses, know that they can be quite quirky and oftentimes they're very, very good for one particular rider, but not necessarily anyone else. So part of me thinks, wouldn't it be great to take this horse for a run around the track and then also think that horse is probably going to buck me off halfway around. Um, I definitely have some client horses, I obviously won't name them, that whenever I work with them, I'm like, "Such a lovely horse, I'd love to jump on that horse one day," just watching how big they move, but also knowing how safe they are. Something like Pegasus would be cool. I know it's not a real horse, but something
No.
with wings is a bit different.
Mm-hmm.
Otherwise, obviously like your Winxes and your famous racehorses, the idea of just that feeling you get when you have a horse and you just let them run and you just hold on and enjoy it, that's a feeling that I'd like to chase again. So
Oh yeah, man. Being on I've not ridden. I mean, I've ridden thoroughbreds, but I've not ridden them in a race situation. It must be like,
no, no. Or maybe so my grandfather was a jockey and he's the one who got me into horses, and definitely some of the stories of the horses he rode growing up, it'd be kind of cool to ride one of them, I guess. So his favorite was a horse called Howdy, so maybe we'll go with that one.
go. It's hard to
There we
choose just
go.
one. It's
How am
like,
I meant to pick just one? Can I have 5?
it's so funny that I ask these questions because I'm one of those people that I have lots of favorites. Like I have favorites, but I have multiple favorites in the
Yeah,
one
yeah.
category.
Yeah, exactly. Yeah, I need more specifics and I can narrow it down to one in
Yeah.
that category.
And last question: if you had 2 minutes with every horse owner in the world, what would you tell them?
I tell them horses are meant to be fun. I get a lot yeah, you get a lot of clients come through and it could be different ends of the spectrums. I have clients come through and I think they love their horses so much and they worry about their horses so much. They almost want there to be a problem with their horse. And it doesn't matter what we do, we never really find anything. And I almost want to tell them, go and enjoy your horse. Like you're lucky that there is nothing wrong with them. Like enjoy them and try not to worry about them. And then I have the other spectrum where I have owners that they're so committed and they want to do absolutely everything for their horse and they are spending so much time and so much energy and so much money in their horses and they hardly get to ride them. And sometimes I want to remind them that, horses are meant to be fun and you are meant to be able to enjoy them. And sometimes for whatever reason, that horse might not be the right horse for you. Maybe it's just not the right match for things are just not working out. And you should be able to enjoy your horse.
Mm.
And I think I guess they're kind of the sad cases that I get. So I guess I want to remind people that horses are meant to be fun. You're meant to be able to enjoy your horse. So always keep that in the back of your mind.
Oh, that's such beautiful advice. Thank you, Nicolle. And we are so grateful to have you. Well, I am so grateful to have had you on today. I've learnt heaps. The horse world is lucky to have you. I think we need more professionals like you who are you're just so committed to what you do. And just in that little conversation, I can see how much you just want people to understand that there's a better way than surgery, and so much we can do for our horses' backs. So thank you so much for your time.
Thank you so much for having me. It's been so much fun, and I can't wait to listen to more of your podcast episodes. This is so exciting. So thank you for inviting me on. It's been great.
Thanks, Nicolle. We'll hopefully catch you again soon.
Yes, definitely.
Bye.
Bye.
Man, I loved that. What an incredible conversation with Dr. Nicolle. I feel like I've completely flipped how I think about back health today, and I hope you have that same sense too. If there's one key takeaway from this episode, it's that back health isn't just about the back. It's about the whole triad of proper exercise, pain management, and nutrition working together. I loved learning that we don't have to jump straight to surgery for issues like kissing spine, and that with the right approach, those transitions, chop poles, carrot stretches, and hill work we talked about, we can actually build the muscle our horses need to support their backs to stay healthy, keeping them comfortable and performing well. And Nicolle, thank you for emphasising just how crucial nutrition is in this equation. As we discussed, you can do all the right exercises, but without the right diet underlying all of that work, your horse can't build muscle and you're not going to get the results you're looking for. Now, if you want to learn more about Dr. Nicolle's work, definitely check out her podcast, The Ultimate Equine Podcast. It's fantastic for breaking down complex vet topics into language we can all understand. And if you loved this episode as much as I did, make sure to subscribe to the Happy Horse Nutrition Podcast so you don't miss our upcoming episodes. We've got some exciting conversations planned and lots more nutrition deep dives coming up. And of course, if you want to make sure your horse's diet is supporting their muscle development and back health, head on over to myhappy.horse to analyse your horse's nutrition. Thanks for tuning in, and until next time, keep your horses happy, healthy, and moving.